Ready? Oh man, it is hot out here. I'm in Hampton Roads, guys. Black Lives Matter. You know, I'm talking to one of the consultants of Black Lives Matter, and I want to tell you, we're talking about healthcare, my favorite topic. We do a lot for veterans at primary care internal medicine. We do a lot for the community, 15 years of internal medicine practice. And we're down here with Black Lives Matter, and we want to talk about something that nobody's talking about. You know, healthcare matters. Healthcare in the black community matters. All right, and healthcare and the black community has been disenfranchised. We know that. Right? Why is it that most of us have high blood pressure? Why is it that most of us are on dialysis? We talked about it over and over again. I speak to all my patients about it. You know, I'm passionate about it. And it's all about healthcare. Right, so Black Lives Matter, healthcare matters, and that's what it's all about. So stay tuned, because we're going to be having meetings. We're going to be having discussions about healthcare, the black community, the discrepancies, the injustices in the black community. Okay? So stay tuned. Black Lives Matter, 757.
So, well, if you could, so what would you say 3 to 5 of the top healthcare concerns are in the black community as of right now?
I think 3 of the three would be high blood pressure. High blood pressure is what we call a silent killer. All right, it causes heart disease, kidney disease, because strokes, all that. High blood pressure. Next is diabetes. Okay. Another issue is obesity. Those are some of the top issues in the African American, and not just African American, poor white communities. So healthcare matters. It definitely does. I know we're always talking about our community and what we could do. One of the best things that we could do in our community is actually look at our healthcare. And it's time that we take an aggressive approach to finding out what are some of the circumstances, what's going on, why is it the way it is. And once we find out why it's that way, then we can fix things. And I want to be part of that. You know, so we need to get together and we need to work it out. So I'm just down here to give Black Lives Matter support, you know, as we tackle these issues that affect our communities.
Can you give us then we'll close it out. Can you just give us a briefing, just kind of the numbers on, we say like dialysis and any type of high food, any type of information or healthy eating, just that we can get from that?
Yeah, well, the first thing when it comes to dialysis is basically patients that have no kidneys. You know, you have 2 kidneys, they have no kidneys, and most of the time, kidney failure and ending up on dialysis is due to uncontrolled high blood pressure for many years and diabetes. Those are 2 of the main factors, right? So what we have to do is we have to start with prevention. It's all about prevention, and that's where my issue is. What are we doing in our African Americans and low socioeconomic communities? What are we doing for prevention, for education? You know, we have issues in terms of even food. You know, the supermarkets. I mean, these communities are starved. They don't even have supermarkets. You got to go to 7-Eleven for dinner. You know, McDonald's. You know, those are the things that we have in our communities. Nothing against McDonald's, but I'm just talking about we don't even have the basic necessities for these people, for our people. You know, black or white, low socioeconomic communities, to have access to just the proper nutrition that would give them a fighting chance. Okay? And then we talk about healthcare and all the money that it costs to take care of these patients when they're sick. You know, but prevention is number 1 thing. So that's where I would start. Before we even get into the dialysis and get to that point, I think the most important thing right now is to focus on what are the discrepancies in our community. You know, what are some of the barriers? You know, some of these barriers are, I am going to say it, institutionalized. You know, we can't get past that word. And I know we're supposed to sound, and I'm not trying to sound radical or anything, but a lot of this stuff is institutionalized. You know, it's been that way. It's always been that way. You know, so we have to actually work towards finding out what some of these things are and making the changes. And I'm prepared to do that. And Black Lives Matter has told me that they're prepared to do that. That's why I'm here in Hampton Roads. So Black Lives Matter, 757. Mm-hmm. All right, they want to do things, and I want to do things. So let's do it together.
All right, y'all. If y'all could, please share this live out. Again, we'll be having more. This is our Black Dr. Fauci. We'll be giving healthcare benefits. We'll be giving healthcare tips, dietary tips, and we're still sorting it out how it looks, but we definitely want to be educating our people as to healthcare, because healthcare does matter. Our body is our temple. That's not just a saying, that is definitely literal. So let's make sure we're living healthy, and we're making sure that Black healthcare matters. Peace and blessings to all.